Hey everybody. Today we're going to do a video of an adjustment, and this is Tara, and she graciously accepted to be filmed for this adjustment. And you originally started with us because you were having low back pain,
Yep.
tension in your neck and shoulders, right? And you were having trouble sleeping.
Yep.
Okay, has that improved?
Absolutely. It has.
Sweet, that's awesome. And now you've got knee pain or knee
Yeah,
swelling
I
and
injured my
discomfort.
knee.
You have a brace?
I do have my
Good.
brace on.
That's
You
a
made
good.
me promise to wear it for 2 weeks
Yeah,
straight.
good.
There
That's
she
perfect.
is.
That's exactly what we wanted. Has it gotten any better?
Yeah, the swelling's going down a little bit. It's
Okay.
still swollen, but
Okay.
I think we're getting there.
All right, very cool. Today I'm going to adjust her spine. And so why don't you go ahead and lie face down, and we'll look at your back. And the way we adjust here is we take x-rays, we do an analysis, and we determine exactly which segments are misaligned, how badly they're misaligned, how many degrees, how many millimeters, and then the summary of that goes on our computer. And so when I'm adjusting, you're going to see me looking up at the computer after every adjustment to make sure I'm adjusting the correct segment and in the right direction, because later we're going to do post x-rays, and we're going to compare those x-rays, and we're hoping to see nice positive changes where the alignment looks good, the scans come out clear, which is a nerve scan. So with Miss Tara here, we saw a disc narrowing right here at the L5 level. And typically when the disc narrows, it doesn't come back up. So it's always going to be tender to touch, always. But we want to make sure we protect that segment in mobility and form and alignment so it never gets worse and never pinches nerves. That's a bit tender when I press, correct? Okay. And so what we're going to do is we're going to do an adjustment called a counter nutation adjustment, where we take the sacrum and bring it down off that nerve. So let's have you lie on your side, face me this way. And you're going to bring this knee all the way up. Oh, I forgot this is the knee that doesn't bend as much.
Okay. Yeah, it just doesn't bend on its own very well.
And slide this hip forward. Good. And keep this here. Beautiful. Crocs. I'm actually going to bring this out like this. That way you don't have to worry about bending it.
Okay.
We're going to pull this shoulder out, hold right there, and keep this knee straight the whole time. I'm going to contact right here where that disc was, and as I roll you forward, I'm going to pull this into place. Here we go. There it is. Did you feel that move?
Mm-hmm.
Good. Straighten this. We're going to go one more, just a little lower, and there's another one. Both of those made a little pop. Now go face down again. The next segment we need to check is on the right side at L1. And L1, not only does it need to go forward, it's posterior, but it's fixated on the right side. Is this tender when I press?
Yep.
Is this one less or the same?
It's less.
Less. So that's the one we need to adjust right here. By the way, before I do that one, let's go back to that disc. Is this the same tenderness or different?
I think it's less.
Good. Fantastic. Like I said, disc tenderness does not go away. Once it's compressed, it stays that way. It's like a disc bulge, but we can maintain it. Turn and face the other way now, right side up. And bend this knee. This one bends a lot easier. Slide the bottom hip. Nice job. We're going to pull this down. And look at that. You've been practicing. You've had enough adjustments. So we're going to contact the L1 segment right here. And what I'm going to do is bring it up and put it into place. Here we go. Let this fall. Goodness, that was louder than the other one.
Yep.
Go on your stomach, and let's check and see if that moved properly. And we always want to make sure the leg length stays even. Leg length discrepancy is because of spinal cord tension. If there's pressure on the spinal cord or tension on the spinal cord, like a pelvic distortion, it will cause the leg length to be different. Her legs are even. That's the right side, that's the left side. Do they seem more symmetric than before?
Yes, and there's no pain over there now.
No pain. I love it. Fantastic. Now, right above it, there's a spot. Take a nice deep breath and exhale. There's that. Now, this is why your shoulders were tight and tense before. There's a rib right there. Is that tender?
Mm-hmm.
And not as bad on this side, correct? So we're going to contact right here. I'm going to hold that rib, and we're going to gently tilt your lovely head to the side. There you go. What did you feel with that?
Felt the pop.
You felt the pop,
It doesn't hurt
and
when
it's
you push on
not
it
tender
now.
anymore. Good. The rib is back where it belongs. Now, turn over on your back. So posturally speaking, the area between your shoulder blades, just below it, is too flat, and we're trying to create a curve based on the posture analysis that we did. So we want to create that curve by putting your hands behind your neck. So interlock your fingers, elbows up. I'm going to roll you up, put my hand right here, and you're just going to fall back. There you go. That wasn't too rough?
Nope, not at all.
Very nice. Now let's check your neck. So on x-ray, we saw a C1 misalignment on the right there.
Yep.
C2 misalignment on the left,
Yep.
right there. And then there's a tenderness here as well.
Yeah.
That one's not as bad as it used to be. Tender right there on the right.
Yeah. I can't tell if it's tender because of
Pressure.
anything other than pressure.
Does
though.
it feel the
Yeah.
same on this side?
Pers-
Right
They're about the same.
and left. Okay, so those are fine. Let's work on C1 and C2. So we're going to gently tilt this way. And hang on, let me tuck this in. Tilt your head back. Here it comes. And I'm actually going to do that one more time. Wait, it's not tender anymore, is it?
No.
Was that where it was? Yeah. All right, we got it. Now this side. So I'm going to come around this way. Tilt back.
Nice one.
That was louder than the first
That one was loud.
Absolutely. Wait, it's close to your ear? Did I tell you why C1's the most important bone in the spine?
Probably, but
Because once you see one, you've seen it all.
oh. I don't think you've said that one to me before.
There you go. I was saving it for the video. Is that less tender?
Yeah.
Good. And C2 is good?
Yep.
And your head stayed attached.
Yeah, it did.
Fantastic. All right. So, that's the video. You may rise. Moving okay?
Yeah.
All right. Fantastic. Well, thanks for joining us, guys, and we'll see you on the next video.